Hi, and welcome to the podcast channel podcastmybusiness.com.au, and also with video through contentmadeeasy.com.au. And today we've got a really good guest joining us, Davis Lemke, the CEO of Clarity Healthcare. We do a lot of interviews with Clarity Healthcare because they are leaders in mental health. How are you, Davis?
Really good. Thanks for having me on your podcast, Dan.
You're welcome. Thank you very much. We were talking before about weather and whatever. I'm in Sydney, you're in Melbourne, and what is the sweet and sour of weather?
Yeah, so Canberrans, if anyone's listening from Canberra, will know this exactly, right? So you've got a really cold and chilly day, but then the sun beams down and it warms you up. It's absolutely great feeling. I love it. And are you getting a bit of that in Sydney today, or it's just a Melbourne thing?
No, we are. In fact, we started off with fog, but I lived in the UK for quite a few years, and you're right. There's no one more beautiful in the world than out in the country in the UK in a nice, glorious, sunny day in spring. A little bit of coolness, the sun on your back. And this is what we were talking about before, about is a bushwalk part of your mental health journey or not?
Yeah, absolutely. I think for everyone, like something like a bushwalk, whether it's mental health and mental well-being, which is kind of subtly different. So, I go bushwalking, not necessarily to recover from any kind of mental health issues, but to stay well. So bushwalking, mountain biking, I think the evidence suggests that physical activity is really good for your mental well-being. And if you do it in green space, it's even better. So, and encourage everyone to kind of find the right thing for them, because obviously, you can't just go off and do anything and expect to enjoy it. You have to find, the right physical activity that, may or may not be in green space that really works for you.
Yeah, and what we also want to touch on is loneliness. So why has loneliness become such a serious public health issue?
Yeah, so it's some of the recent studies are very scary, right? So the UNSW showed that about 40% 15 to 25-year-olds were lonely. Kind of similar study in a broader age group from Medibank that over 50% of the entire population were lonely 2 days a week. So, it is such a significant issue, and the hypothesis is that we're spending a lot more time digitally connecting. We're connecting now, Tony. It's absolutely lovely, but there's a bit more to kind of connecting with the community than a digital engagement. So, getting out in kind of broader groups is, a really kind of good buffer for loneliness. Like I said, while not directly linked to loneliness, there's kind of other aspects of well-being that are really important for your mental well-being. So, physical activity, healthy eating, that connecting with the community that we just talked about, but also at work as well. So, all of those things, have, slightly diluted with that kind of transfer to the kind of digital world.
Yeah, so why are people feeling more disconnected, even though they're more connected, so to speak?
Yeah, it's fascinating, isn't it? Because you're on there, getting information all the time, but the key difference is about connection. So, you might be getting someone on a social media. You don't know them. You haven't seen them before. You're not interacting with them. So you have to really kind of have up to 100 interactions with someone to kind of really build that connection, that feeling that friendship essentially, and having kind of deep conversations helps that, but having kind of transactional many transactional aspects like you do on social media actually doesn't help that kind of social connection, and ends up kind of not improving loneliness.
Yeah, I want to circle back to that one in particular, but you've hit on a particular point. My daughter's a millennial and a new granddaughter, and does she ever pick up the phone and call me? No, it's a text. So do we have to just accept generational aspects like that?
Yes. Well, you've got one step better than me. So my daughter won't text me; she'll only Snapchat me, and so I have to actually download the Snapchat app and monitor that.
Yeah.
Otherwise, So look, obviously, kind of that interaction's kind of changing over time. I think technology can also kind of improve connections as well. So you can't kind of just say it's all terrible. So good examples are kind of for minority groups, LGBTIQ plus, to actually find connections, like deep connections online, which they might not get in if they're from a small farming community, something like that. So I think that, we can't just say all technology is terrible. I think there is some benefits of that. My daughter's kind of met some and connected with her existing friends online, and they've tonight she's doing like a virtual watch party, right? But that type of kind of digital connection is actually really good for loneliness. It's the transactional connecting, trying to connect with everyone without that deep connection that you're making.
Yeah, and I do know what a digital watch party is, so I'll just let people know you all join in and watch an episode of a TV show or something like that, and you all start at the same time and you share your reactions as you go along.
I expect everyone to do a digital watch party on this one, Tony.
Absolutely. The more the merrier. So please, if you're going to do a digital watch party on this, send the feedback. That would be most appreciated. Thank you very much. So there's a few new things in health in relation to social prescribing or green prescribing. So they're all fairly, I guess, recent for me to understand. Can you explain that to me?
Yeah, so I think obviously healthcare is still, but it has traditionally kind of been about treating disease, which kind of makes sense. You've got specialisms of doctors that are actually trained to diagnose and treat disease, but I think the broader perspective that's now coming in to a lot of the work that we do in mental health, but also to what GPs are doing, is that broader wellbeing perspective. So if you've got, if you look at, not just the social prescribing, which is essentially the connecting with community orgs and connecting with groups, and then green scripts, which is it can be kind of going out into the environment doing exercise, or it can be as part of a group. Those two have really started to break that kind of nexus of just looking at disease treatment, and really about how do we improve our well-being, and both our mental and physical well-being, and that actually improves our health outcomes as well. So one of our studies we've done on the Optimal Health Program, which looks at essentially holistic well-being, is if you improve your physical, your mental health together, you build those social connections, you actually reduce hospitalizations for that cohort by 50%. So by improving well-being, you're actually reducing the impact of a disease. Obviously, if you've got diabetes and those sort of things, it does improve your symptoms. You might need other medications to support the disease. But it definitely, there's a lot of real evidence, and a lot of great GPs are really thinking a bit more holistically now, instead of prescribing medication, talking to their patients about how they can improve their physical activity, get out into green space.
So a doctor's going to give prescriptions for getting a dog?
Yeah, look, I think they're definitely going to talk to their patients and really understand what drives their patients and what might improve their well-being. And I think, I certainly think, in some people, getting a dog, getting out there walking, it's a great first step. I suppose even the kind of the connections you get when you go down to the park with other people as well. So, yeah, absolutely.
So, is there such a thing as groups? So you touched on it a little bit before, that are more prone to loneliness, or we need to watch out for a little bit more?
Yeah, so it's really the younger cohorts, really that 15 to 25-year-olds. So, if you've got friends or kids in that group, reach out to them. And, that's why we've built this social prescribing database. So, you can get online. And like I said, if, you might like to go to hikes and mountain biking like me, or you might not. You might want to go to a pottery class. Like, it's actually personal for the individual. And so just kind of, saying, hey, have you seen these type of activities that are happening? Letting them choose really what they want to do. Obviously, get better buy-in that way, instead of kind of forcing anything down their throat. But just, helping them out. And obviously, maybe like you do with your daughter or your granddaughter, texting her back, even something simple like that, to kind of improve that loneliness.
Yeah, absolutely. And okay, so how? This was not what I thought I'd ask. So how do you get past with a son of just having conversations, just grunts?
Oh, did you know I've got a son as well? Yeah. So like, how old's your son, Tony?
He's older than that now. But
okay.
Yeah, so
You remember the grunting phase?
Yes. Yeah.
Yeah. So I think it's with it's the same. Doesn't really matter what their age is. It's really about them finding their own interests and you encouraging that. Whether it's your friends or your kids. Saying, hey, we're off for a hike now. You don't get a choice. There's not going to be an enduring change that's going to happen. And so it's about, exposure to different types of activities and letting them choose, essentially.
Yeah. Okay, again, I want to continue on this a little bit further, because I've noticed that, again, a lot of the younger people, even when it comes to the supermarket, we're used to having somebody at the checkout and we engage. They love the self-service machines because it means they don't have to interact with anybody.
Yeah. So, it's interesting as well, and that kind of it's different to kind of deep social connections, but it's actually important to kind of feel part of a community. Those kind of micro interactions that you get. So like, I wouldn't say it's necessarily as unhealthy as if you're kind of out there connecting with groups. I think it's kind of fine, but but equally, those micro interactions, are important for society and are important to kind of feel part of your community. So I haven't got any specific recommendations on that one, Tony. Have you?
That's good.
You like a chat, do you? You're in the lane where it's queued up behind you, and everyone wants to just wants to get their groceries done, but you're chatting to the teller.
No. Frequently, it's a matter of choose your poison. Do you want to go in the long line for do your own, or the long line for having it done by somebody else?
Yeah, I must say I'm guilty of going in the short line, or even just getting it delivered at home.
Get it delivered. That's right. Yeah, that's fine. So I just want to go back just a little bit about business and business owners, and so how should workplaces and business owners think about connection? Because these days at work, a lot of that is done via Zoom or different things like that. How can they help encourage more connections with their employees and staff together?
Yeah, well, first I kind of just wanted to highlight, obviously there's a lot of talk about kind of psychosocial safety and at work and those sort of things, but the actual benefit the business owners are providing their employees, if it's a good environment to work for, and rewarding is significant on the mental health. So the health benefits of work are really demonstrated. So, huge call out to the business owners who are actually already doing just such a great job for the community's mental health. In terms of kind of how you can kind of bring that up to the next level, there's a few ways to approach it. So, if you've got a kind of fully remote workforce, it's about, trying to bring people in, could be for work, could be for other activities to build that kind of work-based culture. That's really important. The other aspect of it is actually thinking about people's well-being holistically, so not just about at work. So we've got a couple of kind of things we do at Clarity. So one's actually a broad wellbeing plan, which is part of the Optimal Health program. And you on your one-on-ones with your team, you actually talk through that what we've just been talking about, Tony. How are you going, and are there any kind of things you want me as your manager to know that's kind of benefits your well-being. So they might kind of list, hey, we've got a pottery class at 4:30 on a Thursday that's like really important to them in the community. So you can kind of link that in to work, and you can actually develop with your team their well-being plan and support it as you can from a manager's perspective. Some EAP providers kind of support you in that. If your EAP provider isn't supporting you on that, just look up Clarity Healthcare, and we can kind of provide the digital health methodology, because it's actually much more important to kind of proactively talk to your employees about well-being than have a kind of ad hoc kind of EAP service with counselling when things don't go well. So if you can support your workforce preemptively, much better.
All right, so terminology, what do you mean by AP provider?
EAP, so Employee Assistant Provider.
Oh, okay, right, okay, yeah, that's fine. Cool. All right, so yeah, and I know we've got some case studies coming up as well, because again, you are starting to everyone's starting to take more seriously, in a roundabout way, prescribing exercise and getting out and being more social as a worthwhile objective. Yeah,
absolutely. So yeah, I look forward to hearing how those case studies interviews go.
Cool. All right. Thank you. All right. Anything else you'd like to add?
No, I think just like I said, for business owners, encourage you to think about your well-being of your employees. If you've got any kind of questions about either green scripts, social prescribing, or the Optimal Health program, just go to www.clarityhealthcare.com.au.
Great. Thank you very much.